Hi friends, let's talk about the top 10 GI symptoms you definitely shouldn't ignore. GI is short for gastrointestinal, so these signs are telling you something important about your digestive health. And in the end, we're going to talk about a really common symptom that could be a subtle sign of a very deadly cancer. First, let's start with the obvious, rectal bleeding. And this may present as bright red blood or black tarry stools. If you're bleeding fast, a stomach ulcer can give you tarry stools because your stomach acid digested the blood to make it black. More commonly, bright red blood is bleeding somewhere in the intestines. Number 2 is vomiting blood, which is obviously a red flag that shouldn't be ignored. Blood in the stomach is very nauseating and will make many people vomit. Number 3 is pain that radiates to your back but starts in your stomach. So many different things in the abdomen can cause this, from kidney infections to kidney stones to pancreatic cancer. And that's not something you want to miss. It requires an imaging to diagnose pancreatic cancer. Number 4 is the inability to poop. And this may sound like a simple problem, but it can be a sign of an obstruction in your colon. So many things can interfere with pooping, like dehydration, not eating enough fiber, and taking pain medication. However, stagnant poop can cause local trauma and ulcerations to your colon, leading to perforations from the pressure of hard stools. Number 5 is a feeling that food is stuck in your esophagus. It's more than just an inconvenience. In fact, when your food is stuck, it requires a procedure called an EGD, an esophagogastroduodenoscopy, to get that food out. And sometimes it's because you didn't chew it properly and it literally gets stuck. The common food that gets stuck is steak. Other times, it's a first symptom of esophageal cancer, which has caused narrowing of your food pipe. Number 6 is painful swallowing, and this could be due to various factors. You can have a severe yeast infection by Candida, or viral infection like cytomegalovirus, or even chronic acid reflux. And sometimes taking over-the-counter medications like non-steroidal anti-inflammatories can also cause this condition. Number 7 is a loss of appetite. So many things can cause you to lose your appetite, including a hidden cancer. Number 8 is unintentional weight loss. If the numbers on the scale are dropping without any effort on your part, it's time to investigate the cause. Many things can cause this, including cancers like pancreatic, colon, and stomach cancers. Number 9 is rectal pain, which could be a hemorrhoid or an infection or anal cancer. Oftentimes, a visual exam by a doctor can help clarify this problem. And number 10 is bloating, which is very common and nonspecific. Many times it's made due to irritable bowel syndrome, or some food allergy, or being on a low-fiber diet. But occasionally, it could be a sign of something even more serious, like ovarian cancer. If you experience persistent bloating or any of the above symptoms that I mentioned, please see your medical doctor. They can help you make the correct diagnosis and develop a personalized treatment plan to help you feel better. If you like this video, please join me in the next one for more signs and symptoms.